Of side-lying draping. Get enough linen. Make sure you have an equal amount of linens on the front and the back. And you want to find the corners of your linens, so little corners or tails. And you want to tuck in nice and firmly around the low back and hips, so that as you undrape, you're not going to accidentally undrape their bottom. But when you do tuck that in, make sure that you have plenty of leeway with extra linen here, so that as you drape up, you don't lose your linen. Keeping the linen close to her body, of course. We're going to just go up to about the knee before we start using our tails. You can roll it or scoot it at that point. Sometimes if you start rolling at the bottom, you'll actually end up with like this big, thick wad of linen that some clients actually find uncomfortable. So when you're up to this point, you could actually just sort of shimmy it up without actually rolling it, but that's really just whatever works better for you. So then you're going to take the back corner and go under, through the back to the front. I feel like I'm crocheting. Then we're going to take the front corner and we're going to go through the front to the back, and you're going to keep your ends and you're going to make sure you don't lose your ends, so it's easy to keep the person modest, and use your ends to shimmy up and pull up. Sometimes you're going to need to pull them tighter, and sometimes you'll need to pull here to be looser. Come around the corner of the knee before you start trying to do it just with the ends, or you'll get stuck, and shimmy your way up. Make sure that they stay modest in the front and the back as you're shimmying up, but this will fully encircle the leg in linens, so that part of them will be very modest. Just be careful that you don't accidentally make something else unmodest while you do that. And as you go, make sure they stay draped in the back. And sometimes you may have to pull a little here to give yourself a little more looseness. And sometimes you may need your tails like this to pull tighter. Not so tight like a tourniquet. And just going to shimmy it up. And it is good to go all the way up and around the greater trochanter, which is going to stick up nice and obviously. And that is a great, side lying is a great angle to work all the way around the greater trochanter. And this, when you're as far up as you want to go, you can make it a little bit tighter. And if you need to make your ends neater. Excuse me. And does that feel comfortable and secure? Oh yeah. That's all there is to it, and you can get the extra drapes out of the way. And when you're doing myofascial release side lying, if that's your main focus and you're not actually going to do Swedish, you could actually work through the linens, but just like whenever you do MFR with linens, you want to make sure there's enough loose give or sort of extra linens so that when you're doing your release, you're not actually tugging on tight sheets, because that's going to prevent you from releasing the fascia. But if it was this loose, I could actually work right through the linens if the only thing I was doing was MFR. But especially for the demos, it's kind of easier to see what you're doing when you're right on the skin, and some of you may find it a lot easier to do MFR right on the skin. So we're basically going to release the entire side line, which is excellent for any kind of side issues, anything in the hip, low back, shoulder. If they get one-sided migraines, a lot of people have iliotibial band syndrome, tightness there. Sometimes you'll just work one segment of the lateral line if you don't have enough time, and sometimes you'll work the entire length. I'm going to demonstrate the parts of the lateral line. It's easier to edit out if I'm not talking in the middle of what we have to edit out. I'm going to demonstrate the parts of the lateral line that are really straightforward, really fast, and then slow down at the stuff that's kind of more complicated and fascinating and interesting. So the first move is pretty simple, so I'm not going to show you in real time. I'm just going to show you a few pointers. We're basically going to work from the ankle and the foot. And it can be helpful to have the foot positioned so it's draped off of something, because you're going to be actually rotating it in basically with your MFR, so you don't want anything like the other foot stopping you. So for this one particular move, you could straighten their leg or bend their leg just so it's not right on top of the other foot. Is it okay if I get closer on the table?
Mm-hmm. Yeah.
Sometimes I have to get closer to the work. So as long as the foot has room to go, hers actually looks like it actually wants to go that direction, so I don't think we need to actually stretch it in this direction anyway. But we would have one above the ankle and one below, and then just stretch. And as long as the foot is free to move, that's a good position. And then we can move. That we would do that in MFR speed. If you feel like there's a lot of fascial restrictions in the lower leg, you can position your hands anywhere along the line. And if you feel like it needs a warm-up, you can use a hot pack, compression, even Swedish. Petrissage can be nice if you do it in a way where you actually grab the tissue. And then a very nice handhold is one above the knee and one below the knee. A lot of restrictions happen at the joints, and so a lot of times you're going to be doing moves that cross over the joint. Depending on your position, the size of the client versus the size of your hands, you may need to stand in a different position. You may even need to, use your forearms instead of your hands. And again, I'm only going to slow down for real speed at the ones that are a little more complicated or interesting. So this one's pretty straightforward. Just keep in mind that the vastus lateralis on the quadriceps goes all the way in front of and behind the iliotibial band, and that the hamstrings wrap around the edges of the knee. So when you're coming around, feel for the tight tendons on the edge of the knee. Everywhere along the line you can warm up with compression. And I'm just going to avoid that cut instead of putting on gloves, because I don't really need to do the work right there. There's you can use Golgi tendon organ release on the iliotibial band, and the iliotibial band runs obviously the entire length of the lateral leg and becomes into the fascia of the tensor fascia lata and the gluteus maximus. When it gets up into this part of the leg, it sort of becomes flatter and broader, and it's harder to access separately from the muscles, where the IT band is very easy and obvious to access as distinct from the muscle deep to it, which is the vastus lateralis, is in about the 3 to 5 inches just proximal to the knee. So in this region, it's a very thick, obvious band that sticks up. And right now I'm outlining it. It oftentimes is very tight and gets adhered to the tissue below it. There's kind of some things to do specifically with tendons. First of all, it's the muscles pulling on them that makes it tight. So it doesn't work so well to get right on top of the tendon and just try to lengthen it, because the muscles are making it tight. So we both want to release the restrictions and the trigger points in the muscles pulling on it, which in this case is tensor fascia lata and gluteus maximus, as well as separate it from the muscle it gets stuck to. So it tends to get stuck to the vastus lateralis. So you can use friction to carve it out, multi-directional friction, cross-fiber friction. Carve it out and separate it from the tissue below it. A lot of times runners and dancers, a lot of athletes will have incredibly tight IT bands. And the other thing you can do is a simple technique called a Golgi tendon organ release, where you're basically going to grab the sides of the tendon and either pull it in a direction like this or push it in a direction like this. And they call that S bowing or C bowing. So you're basically going to take the tendon and push it into a C shape, or you're going to take the tendon and torque it into an S shape. What this is going to do, and it's not the most amazing feeling technique, I mean it doesn't feel like you're doing anything wonderful, but it actually works with the proprioceptors, which sense the muscle tension and length and the tendon tension. And it basically resets the tension. So you just have to get around the sides of the tendon, get right into the side of the wall of the tendon. So if this is the tendon, and it sticks up pretty good, you want to make sure that you're right up against the wall as you push it. So you don't want to slide on top of it, you want to get down and push it. And once you have it pulled into the shape of a C or an S, you quite simply just hold it. Occasionally it might feel a little bit burning to the client, usually in a mild way, or it might bring up weird sensations, like it might feel a little bit itchy. You're not necessarily going to get to what feels like a client's ideal pressure on this one, and it doesn't tend to feel like something totally amazing, but it can be part of effectively releasing the tension and resetting the muscle tension length. So hold it about 60 seconds to 3 minutes. There's different schools of thought, and some people will tell you, you know, just hold it 90 seconds, or, you know, I don't think there's a, I feel a therapeutic pulse, and it's definitely starting to lengthen. And what does it feel like? How does it feel?
Kind of like I'm being pinched. I don't know, whatever that feels like.
Yeah, it's not really like something you're like, wow, that feels great.
So you're really digging in, or is it sort of a gentle C or S?
You're not necessarily like trying to dig in, like getting really deep into the tissue. You just have to get deep enough so that you can actually quite specifically grab that tendon and torque the shape of it and hold it that way. So depending on how thick their tendon is, how tight their fascia is, that's going to basically determine how deep you go with it. So what I'm doing now is just reassessing, and I tried to carve out some of the places where the fascia was stuck to the underlying fascia, and I can sort of continue along that path, sort of engage the places where it's sticking to the tissue below it. And then I can pull and separate. And then I could, if I felt like this is sort of effective, but that there are other places that could use a nice release. Like I feel like there's some amount of loosening in this area. I feel like it's still quite tight and adhered right there. I could do another S bow or C bow. This can feel really nice to get all the way close to the knees with it. And this is not a Golgi tendon organ release right now. This is just the friction of getting it unstuck from the fascia. And the fascia gets too fuzzy and glued and all the spider webs get sticky and stick stuff together that they shouldn't. So that's really nice to carve out all the stuff by the knees. And then you can sort of take an extension of that and you'll feel the different layers of fascia. So you can engage right with the vastus lateralis and the hamstrings and then get deeper with the cross-handed or unidirectional pull of the fascia. So I'm engaging with some of the deeper layers here all the way into vastus lateralis and hamstrings. Questions on that area? Why don't we stop at every area and then I can load them up as separate. We got a great AV department. All right, so we're going to start to work around the greater trochanter and the hip, and hopefully you're starting to get an understanding of spiraling muscles, or the muscles fanning out like spokes of a wheel off of the greater trochanter and the fans of the hip, and how pulling in every direction from the hip are big muscle groups that can make the hip rotate and spiral. So when we're doing MFR around the hip, the lateral position is a fantastic position to get a lot of big hip rotational movements. Sometimes when they're face down or face up, there's only kind of so far they can go before they kind of hit the table or get stuck. But this is an excellent direction to facilitate big opening and moving. And a lot of people have a tremendous amount of sort of excessive tension in all of the flexion muscles. So there's a lot of things stuck in this whole plane. You guys have already done some psoas release work, but you know, that's kind of the deeper muscle, well, the deepest muscle, iliopsoas, in that region. And a lot of times you'll have a lot more effective global change if you actually get to all the layers of the abdominal muscles, the lats, the thoracolumbar aponeurosis, and then the QL. So we're going to work through all the layers in here, and then all of the glutes, the hamstrings, the quads, and then the deep 6 lateral rotators of the hip.
I have a question. So
Can we pause that for just a second? So what we're going to do is, obviously this is the acetabulum, and we actually have the ball and socket of the hip on top. So what we have with the bones sticking out, which is quite prominent on everybody, the part that you actually get to is the greater trochanter and not deep in the socket. But as you're using the greater, working around the greater trochanter, and then the whole iliac crest, and then the ischial tuberosity, we can do a lot of big rotational movements of the hip as we facilitate. And this is going to help people walk in a more smooth way. All of their movements will be more smooth and graceful. A lot of people are kind of tilted anteriorly this way. Starting off around the greater trochanter, again, it can be a lot of nice crossing over joints. So you can start off with some general crossing over movements, and you're really going to be lengthening this way and then feeling what other sort of torque is going on. Oftentimes you can get bigger surfaces involved. And everybody's torso length is different, but it's super common to have the floating ribs, especially in this position, be super close to the top of the iliac crest. Sometimes you'll have like no space there or just a little space. So as you're, whatever technique you're doing here, you want to be lighter, especially on those floating ribs. And with larger areas and muscles like the glutes, QL, oftentimes it can be nice to get your whole forearm involved so your hands can be the really sensitive, like all the surfaces sensitive and sticky and feeling the pattern. And your forearms engaged in that sensing, but also kind of adding a little bit more of the oomph behind it.
And so those with bigger hands need to watch out for the breast tissue.
Yes, if you have bigger hands especially, be careful as you're wrapping around the sides about breast tissue. And what may not be visible is that I'm sinking in with a fair bit of pressure, especially on my elbow that's around her sacrum. And then my inferior hand and arm is going down towards her knee. And quite a bit of pressure around the posterior. Too much?
Oh no, I'm just moving.
And there it starts to really go. So if you ever feel like it's not moving, you're probably trying to push too much in a straight line, or possibly you're trying to use too much force. But you also can really sink into the different layers of the fascia. So don't feel like you always have to be on that superficial layer of fascia. Some of this work is pretty deep. I'm pretty deep into the glutes where they attach to the sacrum. And then you can shift your body position as the unwinding happens on different angles, or even just as your muscles get tired, so that you don't have to totally stop a move if it's still unwinding. If you can just shift your angle a little bit, you'll be using different muscle fibers and you won't fatigue your muscles as quickly. And now there's a lot more lift around the ribs, a lot more length in the legs, and the ribs are going posteriorly. Is this comfortable?
Mm-hmm.
Yeah. You want to make sure there's a lot of lift when you're on the rib cage. You don't want to be doing a lot of pressure down into the ribs. You want to get just enough pressure to grab and engage the fascia and take it in generally in an up direction, lengthening the torso, but then of course following whatever angle. So don't just use a lot of pressure down, grab that tissue and pull it up. You can reassess and see what in this area needs attention still. And as you work, if you ever need to retighten, you have your ends. Obviously, people can sometimes be ticklish around their ASIS. Make sure your movements are confident, heavy, slow, and deliberate. And don't ever go into tickling the area. It'll be really hard to do serious work if you start tickling this area. May be obvious or not, but I'm adding a lot more lifting around the greater trochanter now. and I've got the ASIS and the iliac crest on my left hand as a handle.
I guess I'm 40.
So you're pushing forward.
With my left hand, and my inferior hand is pulling back and twisting and lifting up at the same time. Go slow and steady enough that you're actually getting fascial unwinding, or it may feel good but not actually be MFR. If you keep moving around so much, it might be nice, but it will be more like compression. And the exact angles that you're doing things at are going to vary from client to client, but just play around with the fact that hips really like a lot of circular movements. So the exact directions you twist and pull are going to vary, but experiment with lots of rolling. It's a bowl, so lots of rolling. Bowls can roll in all directions. And they get limited in that movement, but they really like that movement restored. And as I go, I'm getting deeper and reassessing, working all the way around the greater trochanter to see what's still adhered. And sometimes you're pulling things away, so I feel like there's a layer of fascia here that needs to be pulled away. So I'm going to engage that fascia. I could use both hands if I feel I needed to. It's going to be like peeling off layers. I can't see anything from back here. Is this modest?
Fine.
As I peel?
That's fine.
Okay. So I'm going to grab some tight, deep layers. All my fingers together, so it's not ticklish. As I get deeper here, I got to be steady or it might get ticklish. I'm going to peel away this giant wall of tissue. Almost all people, their thighs are much more undifferentiated than they could be. If somebody is super athletic and actually stretches, you might feel all the separate quads. But for most people, there's a lot of room for work in separating adhered fascia. And then take things out as slowly as you went in. You could come out with some really engaging, grabbing petrissage or compression as you reassess. As you use the iliac crest and ASIS and ischial tuberosity as handles, you can keep reassessing with twisting motions. Because what we want to do here is actually increase the fluidity and the functional movement, not just like soften tight spots. There's something very tight right here. Rather than dive right into the iliopsoas though, it is much more effective to release all the related stuff. If I just dive right into iliopsoas or QL, and a lot of times even if it releases some, all the more superficial layers that are unhappy about the situation are just going to make it go right back to where it was. And another handle that you guys have worked with in the prone position is the ischial tuberosity. All the hamstrings attached there. and it is an excellent place to actually facilitate change in the pelvic rotation. So that's a good place to make sure that you release. And I'm adding a inferior and posterior rotation with the iliac crest. So sort of just to recap quickly, sort of a more superficial beginning position is to sort of cross over, oftentimes with your whole forearms and your hands being very sensitive. But then you can start to really explore the different things that are stuck and short and adhered. And that's good. Effective to work through the drapes. I guess the best advantage is that you don't have to worry about, sometimes we're going to be working pretty far anteriorly and we're going to be reaching around a lot and things. And so if you have them undraped, I guess the disadvantage is them feeling like the drape is pretty close to their front. On the other hand, if you cannot engage the tissue as well or the linen's getting in your way, then you could be definitely undraped. And while you're going to have the drape about to their midline, every move that you're doing is a super easy position to keep your hands or arms on the drape. So you can very easily make it so it doesn't accidentally fall forward. I mean, you can even, as long as you keep the breasts covered, you can actually even go further forward with the drape in the front and undrape them, as long as obviously the breasts and the genitals remain draped. But this particular position for many people can feel like a vulnerable position to have the tummy undraped, because it kind of makes any adipose tissue there is kind of fall forward. Even the thinnest people can feel fat in that position, just like if you were actually reaching around towards their tummy. And, you know, nobody likes to feel fat, so.
So basically, what do you think? Is it better? Do you get the tissue deep in there? Like, do you feel better with the drapes on or off?
I think you can get into the tissue deep enough with the drapes on. I think as long as you don't feel like you're sliding on them, you could basically try first with the drapes on, and then if you feel like they're getting in your way, then you can try undraped. I definitely work with it undraped as well. Even though I'm keeping her draped, I'm going to tuck a lot in case while I'm working anything gets loose. When you do MFR and you leave the drapes on or the linens on, you want to make sure that there's a lot of extra leeway so that as you're doing movements, the drapes are not preventing the movements. So, but we're very much going to be using the iliac crest and the ASIS as handles, and we're very much going to be on the ribs. And basically we're going to do a lot of lengthening in this part of the torso, which almost all people get excessive shortening in this area, and it feels really good to lengthen. As you generally lengthen this direction, the pelvis is also going to rotate down and out this way oftentimes. So you're going to be doing a lot of spinning motions. This is one of my favorite moves on the whole body. I'll teach you the basic concept and what you're basically striving for, but every person you work with, your hand position and the exact order and way that you achieve it is going to be different, and where they're tight and where they're, where they actually are going to need more work is going to be different. But the basic idea is that you're more gently on the ribs, firmly around the handle of the iliac crest and ASIS. You're basically going to squeeze the tissue to engage it in. You're going to lift it up. You're peeling it up and away, and then you're peeling it down. And your bone is a handle, so you're actually going to be rotating the bone as you pull it away. Now, depending on the size of your client, the size of your hands, and where they're stuck, you can't always do that just like this with your hands in both sides, in one, one fell swoop. Sometimes you'll need to sort of approach one side at a time and circle it, and you can totally get the same effect by pushing in and pulling one side at a time. And sometimes, sort of similarly, you'll need to get much bigger parts of your body, like your forearms, engaged in the whole process. So you might need to use your whole forearm to get the tissue, depending on the size of your client and your strength and all that. So it might look something more like this, but if you can, especially some of you guys with big, strong hands, you can grab right around there, or if your client is petite enough. So we have extra, give, and as I sink in, I'm going to assess. I want to be slow, steady, and confident, especially as my fingers are in the front. I don't want to do anything jabby, quick. It will be ticklish and startling. And the stuff that's really tight in there can feel especially tickly or painful or make them get guarded. And I tend to approach this pretty slowly, so I can actually assess how I need to grab that tissue and what's stuck. There's a band of tissue in the back that's tight and stuck. That's going to be part of the picture. There's something right in front that's tight and stuck. That's going to be part of the picture. The base of the ribs, there's some tissue stuck. And now I'm really sinking into the layers to grab the tissue well. So if I just try to squeeze it too fast and start pulling, I'm likely to sort of squeeze it with uniform strength all the way around my hand, as if I was just grabbing onto a can. But we're very much more complicated what's tight and what's loose as we grab around. It's not just like grabbing onto a can. We have to actually change the shape and strength of every surface of our hands to match what's tight. So I'm contouring, I'm like matching exactly what I'm finding. And if I match exactly what I'm finding, when I finally give it a nice like C-clamp grip and pull the fascia, this will have profound effects of what it's lengthening. And people will often feel like you're pulling the deepest fascia from all the way across their tummy, through their body, to the other side of their body. And there's going to be a lifting, torquing, squeezing motion, so I want my triangle base, grounded feet, heels, big toe, little toe, bent knees, and I'm going to have to push and spin with my whole body and my hips. Will you let me know if this is ever uncomfortable or too deep? This can be intense because you're going to find some very tight, deep spots. So just go slowly and check in. This works very nicely with all those abdominal muscles that wrap all the way around the side of the body, as well as the thoracolumbar fascia. So the external obliques, internal obliques, transversus abdominis.
Does one hand pull to the left and one pulls to the right?
Sort of basically, but like right now my left hand is like under her rib cage in the front. and the backhand is more on top of the iliac crest, just because that's the pattern of what I found.
And you're kind of pulling them.
Okay, now they're going, starting to make her taller. Wait for them and follow their breath. Do not get your ego. This is not like a strength contest. Or you could definitely go too fast with them. And they kind of ease out. Something very nice, let go there. You could see her breathing change.
Oh, good. Sorry about that.
All right.
Yeah, I'm good. I'm just tired. I'm starting to fall asleep, so I twitched.
So I'm going to follow a different part of the pattern now. And I think there's one more really stuck spot in the back that I think I need to release before I can show you that first move of how we're going to basically pull both sides apart. So I can change the position of my hands if I feel like grabbing all the way around the front and all the way around the back isn't best, and there's a nice tight spot in the back that I'm going to sink into. Sometimes you can cross over. Remember, the rib side is going to always make sure that you pull that tissue up. Find an angle that my forearm works better on my left. The angle of her ribs, it's getting too ribby there. So play around with shifting your own body mechanics and your own hand position so that you're actually matching big patterns of what's going on. Following the shapes. That actually feels loose enough right there. The stuckness is more wrapping around here. Always add a little teeny bit of twist if you feel like you're not going anywhere. You might just be trying to push it too much in a straight line. Make sure you're cognizant of every part of yourself that's touching the client, that it is actually responding to the tissue. So for example, on my hand that's on her rib cage, the front part of my hand is having to be much, much more lighter than the back part of my hand is engaging in some very deeper, tighter fascia. But I don't want the front of my hand to accidentally do what the back of my hand is doing. And there we go. It's big, big movements now. felt like if you ever like shoveling the sidewalk and you get like a big chunk of ice moving. Get down to the sidewalk and you're moving a whole bunch of snow at once. Ease out, just like how you went in. Reassess. There's going to be all kinds of different shapes of what's going on here. And every client's going to be a little bit different. There's some little wall of something right here in the back more than the front. Okay, so let's see what it does. Aha. It wants to pull up this way more. And then if you're going to lift up, sometimes you need to get closer to the work. May I put my knee on the table again? Mm-hmm. When I asked permission to do that, we were working near her legs. So I don't want to assume that I can just get on the table in a different part of her, near a different part of her body. I only had permission to do that near her legs before. Wow, there's a tremendous amount of softening. Do you feel any changes?
Me?
Yeah.
Yeah.
I bet you when you get up and stand and walk, it's going to be pretty different from side to side.
Oh, yeah.
Now, some places you do massage, and with some clients, it would not be okay to get both of your knees on the table. But because I'm kind of smaller, at least short and relatively to men, sometimes I actually like to get higher with the work because I can get better leverage. Is it okay if my other knee's on the table too?
Mm-hmm.
My foot's behind you, is that right?
Yeah.
This is a much better angle. I can lift her up now. You also have stools under your tables if you want just a little bit of height, but you can't get on the table. This is going to quickly get intense, so I want to go slowly and not go too intense for her. And how's that intensity level?
That's fine.
Okay. Now I'm actually squeezing and doing the lift and separating. Make sure you're going slow enough that the bones can move and the fascia can release. Be careful of the floating ribs. You can't be intense with them. The iliac crest side can be a firm handle, but the rib side cannot, because those are the floating ribs.
So you're actually on them though?
Yes,
And
but
just-
gently.
Just gently.
And the intensity, 1 to 10, if 7 is perfect, 10 is too much.
Go to 6.
No? And here's the tricky part, because this requires a lot of strength. You actually want to go at MFR speed. If I find a cool pattern and I'm not in a good enough position to stay in it, it's not going to really release in an MFR way. So use your lower traps and your rhomboids to wrap your shoulders back. Breathe. Use your iliopsoas to lift your body. And for some of you guys that are big and tall and strong, this is not going to be probably such a workout, and you will not have to get on the table. But if you're short enough, go out slowly, slowly, slowly. Wow, big changes. Celebrate the changes by palpating them, even calling attention to them, instead of just always running from messed up, tight spot to tight spot. Celebrate the changes in the movement of the pelvis by letting the pelvis move in relationship to the rib cage. All right. That's it for that one. All right, so of course, watch where the breast tissue is. Don't go too far forward. Be especially careful if your hands are larger or for larger breasted women. We're basically going to finish working our way up the lateral line, and this works undraped or draped. But basically, to finish coming up the torso, and then it comes up through the SCM. You get some extra drapes to pull it all the way around her arm. And basically we're going to take her arm up so that's why we had the extra. We're completely circling the arm. You can bring her arm up. You can also just have them put their arm up themselves. You could even completely tie it if you wanted, or you can just pull the tail around. Is your arm comfortable in that position?
Mm-hmm.
If they have had a dislocated shoulder ever, remember the abducted and externally rotated is the most vulnerable position for the shoulder, so do not put them in this position if they've had dislocations. But they could be in a much more mild version if going too far over is not good. But if they can be straight up overhead, we're basically going to take one hand on the arm and one hand on the side and do cross stretches to finish lengthening. And how far
This works.
the arm is, can vary as well. So just do that at MFR speed. But that one's pretty straightforward. Make sure that they stay modestly draped as you move the arm. And if you're going to move the arm for them, make sure that you go in supportive circular motions and not like you're just going to grab one part of their arm and just, yank it up. You can also just have them put their hand above their head. Questions on that one? I don't know if you want to stop it. This next one's really... Okay. Last step is basically that the lateral line and the posterior line both go up through the SCM, which is one of the reasons the SCM gets so messed up, and also with our very, very common head forward posture. So basically this position, you can lengthen the fascia from the side and the back, any kind of MFR lengthening techniques and supporting in the occiput, and you can engage right up to the occiput. So you can just play around with different, you can sometimes use smaller tools to grab the fascia in that area. Find where it's actually tight. And sometimes you can get the arm involved as well. Again, whenever you move the arm, you want nice circular movements and you want nice supported movements so they don't feel like you're moving them around like a machine or that they have to help. We already have our tail keeping her modest. You can hold on to it if you want. Let's see, are you comfortable like that?
Mm-hmm.
You can basically sort of scoop and hug the arm. May I put my knee on the table?
Mm-hmm.
You can also have the client scoot back towards you if you just want them closer for reaching. You can basically pull the arm down as you take the fascia up. And again, whatever position works. So gentle, soft fist backwards, if that gets you a good grasp of the tissue. Or if soft hands forward, but you want to be careful to not overuse your thumb, finger, hand strength. So you can probably tell I'm pulling her shoulder inferiorly and stretching her tissue with my hands superiorly. And of course, the shoulder is capable of lots and lots of different angles of movement. So rather than just pulling down in a straight line, you can be cognizant of how you're pulling the arm down. And you can, as you're hugging the arm, you can actually use your forearm to MFR the whole arm. Adding a little bit of twisting torque. Working with her breath. I'm on a very nice tight pattern. Try to match the shape with your whole hand. So it may look like I'm mostly using my fingers, but every part of the hand is actually helping grab the tissue. The tight pattern that I found just happens to be taking me a little bit more posteriorly, but certainly you can take this laterally as well all the way up to the mastoid process. But you're following the patterns that actually exist. And your body mechanics might do better this way, but sometimes in a soft hand. Nice. And you can move their arm around more if you feel like their arm would actually do better, like more rotated or on a different angle. You can either leave it supported on a pillow or support it yourself as you pull it in twisting angles. So it doesn't just have to be straight up or down. I think that's a lot, just with the lateral line. I don't think we have to do scapular mobilization as well. This is really good. Oftentimes getting right up into the mastoid process. I see a lot of you find a nice spot and then put your other fist on the table. You don't always have to have one hand going in the opposite direction, but you should always have both hands on the client. So if the other hand wants to just be supportive somewhere and listening, that's totally fine. But once you put it on the table in a fist, it totally changes what you're doing with this hand, and she can feel it.
Mm-hmm.
You may think that you're just focusing here, but there's something about doing this that really disengages you. So make sure that, the other hand, like I said, your body mechanics are not always going to work out to be like cross-handed all the time. But you could totally just be like supportive with the other hand on the client. Or it could even be like right in the same, it could be totally gently resting on the same hand. But make sure that it is feeling and engaged. I was missing that in all the previous videos.
Okay.
Yeah. You're lucky, we're almost done. And you can even use the arm, like the whole arm, coming down in an MFR way to pull that fascia as well. So there's a way to actually pull joints or whole limbs in an MFR way, and it's basically supporting them. Put my knee behind you again. It's basically supporting them, lengthening them, and then going at MFR speed.
Does that say if she's had a dislocated shoulder?
This position actually is a lot safer. It's mostly that abducted, externally rotated one that's tough. So this is a lot like traction, but I'm going to use her whole arm like a handle and feel the unwinding. So as it starts to unwind, I keep that tension on it. And explore different angles. And then go back out slowly. And that's the entire lateral line. That totally changed your shoulder. Yeah,